Welcome everyone to Engage at Home, brought to you by the county's Caregiver Support Program. Today's presentation is through the county's Asian American Health Initiative. My name is Sanjana and I'm a program manager at the Asian American Health Initiative.
Hi everyone, my name is Sapkota and I'm the Behavioral Health Program Coordinator with Asian American Health Initiative.
Thank you so much for joining us today. We're really excited to have you here, and we're excited to introduce you to the Asian American Health Initiative and our latest mental health photonovel, which focuses on family caregiver stress and burnout. We hope today to provide an inside look at the development of our photonovel and discuss some of our projects and programs with you. So we're going to switch over to our presentation now. As mentioned, today we'll be discussing AAHI's latest mental health photonovel that discusses caregiver stress in the Asian American community. But before we dive into our photonovel project, we're going to go over a couple more things. First, we'd like to provide you with an introduction to the Asian American Health Initiative, also known as AAHI, as I've been saying. We'll also share a little bit about the demographics of the Montgomery County Asian American population and talk a little bit about the population that we serve. We'll then talk about our mental health program, as well as our photonovel project overview. And lastly, we'll introduce you to our mental health photonovel number 6. A little bit about the Asian American Health Initiative. So the Asian American Health Initiative's mission is to improve the health and wellness of Asian American communities in Montgomery County by applying equity, community engagement, and data-driven approaches. The need for the Asian American Health Initiative arose in the early 2000s as we saw a rapid growth of Asian Americans in Montgomery County. And with that growth, we also saw that there was a growth in the linguistic and cultural barriers to the different healthcare services for Asian Americans. And as well as the population grew, we saw that there was a widening of health disparities among Asian Americans. When we talk about the rapid growth of Asian Americans in Montgomery County, it's important for us to look at these demographics more closely. Asian Americans are often categorized as one group, Asian Americans. But when we break down that term Asian Americans, what we see is a community with such diversity in culture, language, and socioeconomic status. Looking at the Asian American population in Montgomery County, Asian Americans account for 15.2% of the county's population, and they represent 16 different Asian ethnic subgroups. The largest ethnic subgroup in the Asian American community is the Chinese community, followed by Asian Indian, Korean, Vietnamese, and Filipino. Even beyond these 5 largest subgroups, there are many, many more Asian American groups in Montgomery County, including the Pakistani, Japanese, Taiwanese, Sri Lankan, Nepalese, Bengali, Burmese, Cambodian, and more. Here we have some data for the Asian American population by age, and specifically the older adult population. What we know about the Asian American older adult population is that they currently make up 14.6% of the Asian American population. So those who are 65 years and older and are Asian American make up 14% of the Asian American population in Montgomery County. We also know that Asian Americans tend to live in multi-generational homes, with grandparents also being caretakers and watching over their grandchildren. When we look at the breakdown of Asian Americans with regard to their age, we see that about 30.4% of Asian Americans over the age of 65 have a disability. We see that also that when we look at this age breakdown, the population 55 to 64 years of age is growing, and in the next few years is expected to be the largest older adult group within the Asian American population. The significant increase in the number of older adults within the Asian American population means that there's a need for more formal care and support, as well as family caregivers. We're going to switch lenses now and discuss AAHI's mental health programming. The focus of today's presentation, the latest mental health photonovel, sits at the intersection of AAHI's mental health and senior wellness programming. In response to the unmet mental health needs in the Asian American community, AAHI has developed an array of mental health programming. Some ways in which we continue to tailor our programming to meet the mental health needs of the Asian American older adult and caregiver population include these different types of programming that we have here. We conduct mental health outreach, such as educational workshops at community centers and faith-based organizations, and provide seminars on various mental health and wellness topics. We also have what we call resource tables. We go to local community organized events and senior centers to hold these, and we engage and connect the community members with needed resources. We have our mental health toolkits, which consist of slide decks and resources relevant to the community and are available on our website for download. Toolkits are meant to provide community members with ready-to-go presentations they can use to conduct their own mental health workshops. We currently have 2 toolkits, one that introduces mental health and dimensions of wellness, and another that discusses how to seek care for your mental health. Additionally, to continue empowering our community leaders, since 2016, AAHI has provided free mental health first aid trainings to Asian American community leaders and members to better support their community. In exchange for the free training, we ask attendees to commit to reaching out to at least 30 of their community members to initiate conversations on mental health. By increasing conversation around mental health, we hope to normalize it and remove the stigma around it. To better equip providers and local healthcare program staff and with a better understanding of the unique needs of Asian American clients and to enable them to be more culturally responsive, we've also developed 2 models of a cultural competency training. We have one model that focuses on mental health and behavioral health providers and another for older adult serving providers. And finally, our mental health photo novel project. Photo novels are an evidence-based health education tool used to communicate health messages to limited English proficient populations. By using pictures and stories, photo novels can communicate complex health information in a culturally sensitive manner. At AAHI, all of our photo novels are available in 5 different languages: English, Chinese, Hindi, Korean, and Vietnamese. We'll go in depth about the photo novel project and our latest photo novel in the next few slides. These photo novels were developed to address specific mental health needs for the Asian American population. In 2015, we developed our first photo novel that introduced mental health and debunked some of the myths about mental health. This photo novel also highlighted the signs and symptoms of mental illness. Moving along at photo novel number 2, looking at the general population, Asian American adults have the lowest mental health service utilization rate and the highest mental health service termination rate. Therefore, photo novel 2 depicted what the therapy process looked like to provide Asian Americans with a better understanding of what to expect when they come to therapy and when they seek mental health care. Looking at photo novels number 3 and 4, we address the adolescent mental health needs. Suicide is the first leading cause of death in Asian American youth aged 10 to 14 years of age, and these youth face various stressors and unique challenges while trying to navigate the acculturation process. Photo novel 3 and 4 address the unique cultural challenges in the Asian American adolescent population and provide resources to support them. Knowing that Asian Americans are the largest 65-plus minority group in Montgomery County, we shifted our focus in 2018 to address the needs of older adults and their caregivers. During our extensive research, we identified loneliness and social isolation to be a prominent issue in the Asian American older adult population. We also recognize the unique challenges faced by family caregivers. With a growing population, there's also a growing need to address the topic of caregiver stress and burnout on this population. I'm now going to turn this over to Sammy to speak more about the recent photo novel development process.
Thank you, Sanjana. Hi, everyone. This is Sammy once again, and I'm going to dive a little bit deeper into the development of our 6th and latest photo novel. As Sanjana stated, we recognize the unique challenges faced by Asian American family caregivers that is often not discussed in Asian American culture. Often, Asian American families do not even self-identify as caregivers because taking care of one's family or parents is viewed as duty towards our loved ones, and expressing stress or hardship often may be viewed as a sign of disrespect towards the family members or even weakness. We have caregivers that provide an average of 20 hours or more unpaid in-home care on top of their full-time jobs to the family members, but were not being compassionate to themselves to take care of their own needs to practice self-care. So these caregivers internalize these feelings and do not seek support when needed. We observed that although many resources existed to support family caregivers throughout the caregiving process, due to multiple factors, these services were often underutilized by Asian Americans. We will address some of these factors later in the presentation as well. The goal for this photo novel today is to raise awareness and educate readers about caregiver stress and burnout among Asian Americans, to destigmatize and normalize the conversation about mental health, increase and improve access to local mental health resources and services. Through the production and dissemination of this photo novel, community members will be able to identify signs, symptoms, and risk factors of caregiver stress and burnout, understand how caregiver stress and burnout have a long-term effect on mental health, identify resources for caregiver support as well as for older adults, identify coping skills to deal with caregiver stress, and also self-identify as a caregiver. So in general, common factors that leads to caregiver stress and burnout include long-term health problems in the person they're taking care of, demands of constant care, fear or uncertainty, financial pressure, guilt for not being able to do more about the situation, sleeplessness, a shift in roles. Perhaps it is difficult to witness or accept the sudden changes in your parents or family member and find yourself taking on responsibilities which the person once may be responsible for, and even denial about the disease, having a hard time accepting your loved one is being affected by a condition they're going through. In addition to these already existing factors leading to caregiver stress and burden, some additional contributory factors that are unique to Asian Americans includes lack of community networks. This is the case for both the loved one receiving care and the caregivers. In many Asian cultures, individuals are deeply connected to extended family and neighbors and have a sense of community. In immigrating to a new country, these community networks are lost and leave individuals without the community support they may have grown to rely on. The difference in cultural norms, facing double challenges, such as individuals who are trying to navigate the American system and ways of life to survive in the US, alongside making constant effort to take good care of their parents as a culturally expected and desired behavior. There's acculturation, language barriers, and also a lack of culturally and linguistically appropriate resources. Also, sometimes the services they did seek out may not fully address or meet their individual needs, which in turn are the factor that leads to increased stress, increased caregiver stress and burnout. Therefore, we wanted to develop a multilingual educational material that addresses these barriers in a story format. So let's take a little inside look at AAHI's latest photo novels and why this is the community-driven project that it is. I'll go over some of the steps we took to develop this photo novel to meet the needs of the Asian American family caregivers. While developing this photo novel, we wanted to ensure the story truly captured the struggles of the caregivers, the conflicts, the barriers to resources, and solutions from all angles and perspectives. Therefore, to make certain that this was captured, we recruited a cohort of what we called mental health ambassadors. These are individuals who have varying perspectives on the caregiver experience and who shared their time, energy, and expertise to guide and advise AAHI in the development of our photo novel. In this cohort of mental health ambassadors, we captured 4 different perspectives. So first, we have individuals who provided us with the lived perspective. So these were actual caregivers who are caring for a loved one and shared their experiences. They shared with us the challenges as well as the success stories and provided a better angle on how to approach this photo novel story while being sensitive to Asian American culture and community. We also included the expert perspective. So these are the leaders who have worked directly with family members or developed programming around it. The experts were able to share experiences from another side of the spectrum and provide information on how their effort has assisted the caregiver and older adult community. The culture perspective ensured that this photo novel storyline was well aligned with the challenges faced by the Asian American community And finally, we had the community leader perspective. So those who worked and advocate for the Asian American community in the county. Our ambassadors provided 3 rounds of review and guided on the story, graphics, resources, and even title for the photo novel. Once we developed the storyline, we identified and recruited passionate community members and community champions that supported this project by acting in this photo novel. These community members are leaders, volunteers, and advocates for their respective communities and represent the 5 largest Asian American subgroups in the county. The beauty of why this photo novel is the community-driven project that it is because we have the leaders and community members that are deeply involved throughout the process of this photo novel project. Without their leadership and support, this project would not be what it is today. Caregiving is challenging. When caregivers are not responsive to their own needs and self-care, conflict can arise. It was really important for us to capture the relevant conflicts that are often faced by caregivers with other family members. We wanted to be able to capture some of the external and internal conflicts and internalized thoughts and emotions that many caregivers feel. We also wanted to show that depending on the caregiver situation, the challenges they face are unique. We achieved this by centering our story on two adult siblings who share the responsibility of taking care of their older mother. By using siblings, we were able to capture how 2 people can experience the same challenge in different ways and how that manifests in their sadness and anger. Additionally, while the outward expression may show anger and frustration, we also wanted to portray the internal struggles between these 2 siblings. Sometimes caregivers have misconceptions that increase their stress and get in the way of self-care. Some commonly expressed feelings include, I'm responsible for my parents' family's health. If I don't do it, no one will. Our family always takes care of their own. I promised my father I would always take care of my mother. It was important that we communicated caregiver stress and family conflict by use of nonverbal communication cues. So we used thought bubbles to show these internal thought process. We had the actors looking distressed, angry, sad, and frustrated, but also showed the transition later on where with the solution they felt supported, happy, and energized. Family caregivers are a vital part of the community, and it was important for us to continue raising awareness about the county resources available to caregivers and their loved ones. Asian American caregivers are engaged in significantly higher number of caregiving tasks and report lower level of use of formal support. So without the photo novel, within the photo novels, we highlighted these services and also added the education piece to it by including signs and symptoms of caregiver stress and tips on practicing self-care, which is often neglected. Finally, to meet the linguistic need of the Asian American community in Montgomery County, we also translated the photo novel in multiple Asian languages. We also were able to get these photo novels reviewed by members of the community to ensure cultural appropriateness. If any community organizations are interested in adopting these photo novels and creating mental health photo novels to meet the linguistic and cultural needs of their community, the publisher files are available on our website for download. You can also always reach out to us for further support. We're excited to share this photo novels with all our viewers today. To access this photo novel, please visit www.aahinfo.org under the resources tab. We have also developed a promo video to introduce the photo novel and invite you to view it. The link to the video will be shared at the end of this episode of Engage at Home. You can also go directly to our YouTube page by searching the keywords Asian American Health Initiative. Thank you everyone so much for being with us today. Please feel free to reach out to us and stay connected with us on our social media sites. You can search the keyword Asian American Health Initiative on our Facebook or YouTube, or tweet us at AAHI_info. We would love to hear from you. If you're interested in any of our mental health programming, please let us know. We always welcome any opportunity to collaborate with the community. Lastly, we also want to thank Engage at Home and the Montgomery County Caregiver Support Program for this opportunity. Thank you.